So, PRPs, which is short for platelet-rich plasma, is a type of therapy that's been used for over 20 years in almost all branches of medicine. So PRP systems, which is short from platelet-rich plasma, is a type of therapy that has been used for over 20 years in different fields of medicine, from orthopedics, ophthalmology, dermatology, and in most cases in oral surgery and in dentistry. Surgery, implantology, sinus lip surgery, apicectomies, and bone augmentation, or any type of oral surgical procedure in dentistry. Wound sockets after tooth extraction. So in this video we're going to talk about, mainly focus about oral surgical treatments that have been done with different types of PRPs, and also there will be mention for dermatology, but this is a topic for another video. So yes, so if you stick till the end of this video, you will have better knowledge, understanding what PRPs are, what types of PRPs are available on the market, and what can it do good for you if you have any appointment at your doctor's office. So let's get back to the PRPs. So today, after 20 years of using the PRP development, there are several dozens different brands that made up their own PRP system. So what does it mean? It's basically the whole PRP system functions like this. You take some blood from the patient on the day of the surgery or any treatment that is being done, and you centrifuge it and you spin it in a centrifuge, medical centrifuge, where depending on the type of the PRP system, the blood is being separated in different layers. Some layers are then used, which are rich in growth factors, fibrin, or cells, or different types of cells, also depending on type of PRP system that has been used, then are used to treat various different types of wounds or cosmetical issues, or any other type of therapy that is needed for the patient. You have PRP systems that avoid all cell use, that only use platelets and growth factors and fibrin, and there are some that promote that white blood cells are better for the patient, that are not. Everybody has its own story behind it. You should find the doctor has its own PRP system, or maybe more types of PRP system in his office, and he will probably choose what he thinks is best for you. I personally use a PRP system that is probably I won't say the oldest, but I cannot say the best, but I think it's the best, because I've been using it for over 7 years, and this PRP system has been around for over 20 years, and it hasn't changed since then, because it is made perfect. It has been made really good since day one, and it's called the PRGF system, which is developed from BTI, which is short term from Biotechnology Institute, and I'm also a opinion leader regarding this PRGF technology and their implants and all other medical devices that they produce for patient treatment. So when we talk about different types and brands of PRPs, their goal is to accelerate wound healing, to reduce postoperative stress, pain, edema, and complications, to reduce the time of the wound healing, and to increase the wound strength over time. So these are the main areas on which PRPs are based around. There are different types of brands of PRPs. Of course, some types use, all of them use growth factors and fibrin in their plasma, but different PRPs draw growth factors from different types from different origin. My system that I use, the PRGF system, draws growth factors from platelets. Other systems draw some from platelets and some from leukocytes. Other systems draw from something else, or separate them differently. So this is really they're registered products. Because of registered products, many different types of PRP systems had to be developed so they cannot be the same as other systems because of market. The point of platelet-rich plasma treatments is to reduce the pain, reduce the inflammation, reduce the healing period of the wound, to have a better and stabilized income of growth factors in the wound itself. Because when we talk about wounds and healing of the wound, it has a evolutionary. It has when we talk about wound healing, the whole idea of wound healing has an evolutionary concept in this particular matter. Wounds, when we talk about wounds and their healing, they go through certain types of symptoms and stages that are completely normal to wound healing. You have on Latin what we call dolor, rubor, color, and tumor, and functionalisa, which is referred to dolor, which is pain, color, which is coloration, which is usually the color red, tumor, which is in medical terms considered as a swelling, and color, which is called for that the wound is a little bit more heated up, it's more warmer than the rest of the body. This is completely a normal physiological response to wound healing, because you have a wound that needs supplies, that needs nutrients, and you have blood vessels that then they spread and dilate more to have more nutrients to go to pump to this area, so this whole lesion can heal quicker. This is why the lesion is more red, because there's more blood vessels in there's more blood in it because of the dilatation of the blood vessels. It's more colorful because of the blood. It's swollen because there is more intracellular fluid inside, and also there is more blood pumped through the blood vessels. And it hurts because it's an evolutionary thing, so you protect the wound while it heals. So, but when we have artificial wounds, this is something that is not important anymore. So with the growth factor, with the PRP systems, we take all those nutrients from the peripheral part of our body and transport them not via blood vessels and over time period, but directly through the tubes, directly inside. We transport it directly from the periphery of the body. We separated those growth factors from the blood and concentrate it in more volume and in more percentage then it's in normal blood, and we place it directly into the wound. With this, we skip over those healing periods that are needed for normal nutrients to come from the peripheral part of the body into the wounds to heal. This is we do not completely remove the pain, the swelling, the edema, the time of tissue healing, but we drastically reduce it. This is really important to know, and this is a really big step in medicine to reduce the healing period and to reduce pain for the same wound and for a less amount of time, and to create a better stable healing period, because you have less chance to gain a opportunistic infection, because the wound is closed up quicker than in normal classical wound healing. I hope you click the like and subscribe button, and check out my other videos regarding bridges, implants, and all those restorative materials that can help you to restore your missing teeth and to gain more information what is the best dental solution for you. I hope to see you in my future videos. Leave a comment on the comment section down below, and see you soon. Bye.